Now, I know you're here for retirement planning, so I'll spend almost all of my time on the retirement parts of the program. I want to take just a couple of minutes here at the start to talk about the other parts of Social Security. Because almost all of the time, when people think about Social Security, all they think about are retirement benefits. To most people, Social Security is just a retirement program. Now, those retirement benefits are indispensable. We could not do without them in this country. But based on my 33 years working for the program, I can assure you those retirement benefits are by far the least important part of Social Security. They also pay survivors' benefits and disability benefits. Most people are aware that Social Security insures us against loss of income due to premature death or disability, but most people don't know how important those benefits are. But as you just heard me say, I think they're far more important than retirement benefits for a lot of reasons. The number one reason is human nature. We look forward to retirement. We make plans for retirement. Evidence right in front of me, taking time out of your lives. Some of you had to fight the traffic to get down here to come and make plans for retirement. So the fact that you are sitting in this room right now means you're good planners. So since you're good planners, I guess we can assume if this seminar had been advertised to you as a seminar on preparing to become disabled, you'd all be here right now, right? That's human nature part of it. We don't think it's going to happen to us. We don't think we're going to pass away or become disabled before we reach retirement age. But that assumption turns out to be wrong for a shocking amount of people. 1 out of 3 workers, 1 out of 3, will either die or become so disabled they can't do any type of work at all before they reach retirement age. The great majority of those 1 out of 3 don't die before retirement age, which is the good news, but they become disabled before that age, which is much, much more expensive, which is the bad news. On those survivors' benefits, if a parent should die that's worked and paid into Social Security, they'll pay a check to each child until that child turns 18. With a group this size, at least 8 people in this room, probably more, at least 8 people in the room right now, either received those benefits when they were a child because a parent died, or received them for their own kids because their spouse died at a young age. 33 years working at Social Security, I saw a total of 0 families that when that wage earner died, they didn't need that check to keep their house, to keep making that mortgage payment. Because nobody has enough life insurance to replace the earnings they'd lose the wage earner were to die. People think $1 million life insurance policy is a big policy. Take a 35-year-old father, 3 little kids making $100,000 a year with $1 million life insurance policy, passes away. Without that Social Security check, that $1 million is gone before the kids even thought about going to college. And if people don't think they need to buy enough life insurance, nobody ever thinks at all about disability insurance. But we need that far, far worse for 2 reasons. First of all, we're 500% more likely to become disabled than we are to die before retirement age. And second, the most expensive thing a person can do in their lifetime is become disabled. If somebody becomes disabled, their paycheck stops, but their expenses skyrocket. Now, when Social Security says disabled, they really do mean disabled. For someone to receive disability from Social Security, they have to be so disabled they can't do any type of job that people do for a living that exists anywhere in the 50 states. So by law, a very strict requirement medically to receive disability from Social Security. Unfortunately, a whole lot of people end up meeting that requirement. 25% of all workers will become disabled and receive those benefits before they reach retirement age. 1 out of 4 workers. I always mention this because a lot of people are like my youngest son. They found a different way to make a living rather than going to work for somebody. He's a writer. He just writes from home, gets assignments online to do all kinds of writing, gets paid well. He lives in San Antonio. They're just begging people to go to work there. So I told him one day, I thought, you got a master's degree, people begging you to go to work. Why don't you get something more steady? He said, well, Dad, I've had to raise my prices 3 times just to keep my workload manageable. So I guess money-wise, he's doing okay, but he has 0 benefits. If he became disabled, all he would get was that Social Security check. So I'm trying to convince him to buy disability insurance. You can't tell 30-year-olds much, but I'm trying. But if you have a child who's working in that gig economy, encourage them, because the number one reason, every good times, bad times, almost the only reason families fall into poverty permanently is a disability wage earner. So what insurance do you buy that helps you avoid the number one reason families fall into poverty? Now, I start with the gloomy side for one big reason. It gets your attention right away. I can see that it did. The more cheerful side of all that is for 2/3 of us, we will reach retirement age without becoming disabled. And we are on that lucky 2/3 group in this room, aren't we? Until we're not, which is what makes that part of the program so important. So retirement benefits, what you came for. When we're talking about Social Security, that term, retirement benefits, is not just a generic term, it has the specific meaning. Retirement benefits at Social Security means the benefit we can receive based on our own work at a certain age. That minimum age is 62. We have to be at least 62 to receive retirement benefits from Social Security. At 62, though, those benefits are reduced a little bit for each month we are younger than our full retirement age. If you look at the handout at that chart on the first page, you can see based on your year of birth what your full retirement age is. Back in 1983, because people were living a lot longer, Congress passed this law, which, as you can see, raises that full retirement age gradually to 67. But no matter what yours is, if you are retired when you turn 62, you can start reduced benefits then. So 62 has not changed for reduced benefits. To give you an idea about why Congress did raise that full retirement age, a few years ago, back when I was still working at Social Security, I was up in Baltimore at their headquarters for a meeting. The actuaries of the program came to speak to us at this meeting. They told us that of the people born 1960 and later, who have 67 for their full retirement age, they think there's a good chance they'll live an average of almost 30 years after they start receiving Social Security retirement benefits. An average of almost 30 years. And some experts are saying that we baby boomers will be the first generation that on average will live more years in retirement than we spent working. If not us, then the next generation is what they're saying. So anyway, that's why Congress did raise that full retirement age. But no matter what yours is, if you are retired when you turn 62, you can start reduced benefits then. The question is, should you? Well, it's your decision, of course. I can give you the information you need to make an informed decision. First of all, it's a month-by-month reduction if you take the benefit before your full retirement age. Each month you're closer to this age when you start your checks, the checks will be a little higher. If you begin your benefits when you're 62 years and 7 months old, that check will be a little higher for the rest of your life than it would be if you started the month before. So it's a month-by-month reduction. If you start exactly the month you turn 62, at that point you would receive between 70 and 75% of what you would have received had you waited until your full retirement age. The exact percentage you get if you start your benefits exactly the month you turn 62 depends on where you fall on this chart, what your full retirement age is. So if you are retired when you turn 62, so that you can receive those checks, and you decide, no, I'm going to pass those benefits up and wait until my full retirement age, by waiting, you would have a bigger check each month for the rest of your life, but you would have passed up the checks you could have received in exchange for that higher monthly check. With that higher check you get by waiting, it would take you about 12 years receiving that higher check to recover the money you passed up by waiting. So in other words, if you take the reduced benefit, you're ahead 12 years past your full retirement age. That's a break-even point. Now, I know that 12 years sounds like a long time, but when you're making that decision, keep in mind the average person is going to live a lot longer than that if they start drawing benefits. Think about it, it's a much different world than it used to be. When our grandparents were 70, They were really, really old at that age, weren't they? Matter of fact, if you're a baby boomer like me, most of your grandparents didn't make it till 70. That was beating the odds for that generation. Nowadays, if somebody dies in their late 70s, we think they died young. It's a much different world. The reason it pays most people to wait as long as possible to start those benefits is because when people start living longer, insurance companies can just change their tables anytime they choose, which of course they do on a regular basis. That's why life insurance costs less now than it did 30 years ago. We're living longer. Social Security tables are based in law. It takes an act of Congress to change them, which they haven't touched other than raising full retirement age a little bit, and we're living longer than they thought we're going to when they did that. Now, Social Security started paying reduced benefits, which means benefits before full retirement age, in 1958. And full retirement age was, of course, 65 back then. So you couldn't take early benefit. You had to wait till 65 before 1958. So what that means is the reduction for taking the benefit early is based on how many more years the average 65-year-old lived in 1958. We're living a lot longer on average past 65 than we did in 1958. So if you're the average person, you'll draw a whole lot more total dollars in your lifetime by waiting to take an unreduced benefit. Matter of fact, I do a lot of calculations, I do personal consultations. It's quite often $100,000 to $200,000 more in your lifetime received if you don't take it early. But nobody's the average person. You are who you are, so your decision to make. Now, people ask me all the time, they say, when's the best time for me to start taking those checks? Wanting me to make that decision for them. I've thought about this a whole lot. I can still only come up with one way to answer that question. And that is, tell me the date you're going to die. I think it's time to start taking those checks. Otherwise, my crystal ball doesn't work that well to make that decision for somebody. But if you do have some kind of inside information, and you know you're like some people I used to visit back when I worked at Social Security, you might want to wait and take that full benefit at your full retirement age. Social Security does a special project every couple of years. In this project, they go out and visit all the people over 100 years old who are receiving Social Security benefits. You might not think that would be a big project, but by the way, that is the fastest growing part of the population. For the last 15 years or so, the fastest growing part of the population by percentage has been the people over 100. Now, the purpose behind this project, this is a security audit. The reason they go see all the people over 100 in person is so they can verify that they are still alive, that they haven't died and somebody hid that fact and kept cashing those checks. They don't tell them that's why they're out there talking to them, but I found out a lot will figure it out on their own. I used to help a lot of the local offices around the DFW area with this project because they needed help with it. There are so many people over 100. A few years ago, they had to change the project. They can no longer go visit all the people over 100 anymore. There's way too many. So now when this project comes around, they just go see the ones they haven't seen yet, the ones who have turned 100 since the last time they did the project. Because just this year, just in 2023, just in the state of Texas, more than 3,500 people will turn 100. That does not count the ones already over 100 January 1st. That's 3,500 more turn 100 just in Texas in this one calendar year. That's why you don't sit on the news much anymore. Something that happens 10 times a day, every day of the year in the States, no longer news. Not only are there a lot more of them, they're a whole lot healthier group than they used to be. Of these 3,500 people that will turn 100 in the state this year, the great majority are not in a nursing home. Most of them still live out in the community. Quite a few of them still live in their own homes, all by themselves, taking care of themselves. And I really do mean taking care of themselves. I've seen a few of these people mowing their lawns at 100 years old when I drove up to their house. One year I had to go to a person's job site to find him. He was still working at 100. Had to go to his job. Let me tell you about one lady people always find amusing. We visited her quite a few years back when we visited all the people over 100. She was 103 years old at this time we went to see her. She lived all by herself in her own home on the west side of Fort Worth, which is the older part of town. Just in great shape physically, really sharp mentally. As we were talking to her that day, she got curious. She said, well, who's the oldest person you have on your list? We looked, we said, well, the oldest person in this area is the lady right here in Fort Worth that's 108 years old. Well, this 103-year-old's reaction to that was, 108? Wow, now that's old. So if you're going to be like her or that 108-year-old and pay to wait before retirement, you money ahead. Your choice. Or you might even want to wait longer. Once a person reaches this full retirement age, there's no limit on their earnings. When somebody is younger than full retirement age, there's a limit how much they can make from work without affecting their benefits. But once they reach their full retirement age, they can keep on working full time, receive their full benefits. But even then, some people don't take their checks in. Some people even wait till 70 to start those retirement benefits. Why would they do that? Because of something called delayed retirement credits. For each month from your full retirement age, the age on the chart, until age 70, that you don't take a retirement benefit, when you do take that check, they'll add something extra called a delayed retirement credit. They add that extra for each month. You don't take a check from full retirement age to 70. Over 12 months, it adds up to 8%. So if your full retirement age is 67, and you don't take those benefits until 70, 3 years later, your check would be 24% higher for the rest of your life. 8% each those 3 years. But don't delay past 70, because they quit adding extra credits at 70 no matter what. Also, those delayed retirement credits only apply to retirement benefits, which are benefits based on our own work. Delaying a spouse's or widow's benefit past full retirement age would not increase those. But just to make sure we're all on the same page, let's say the husband was the higher wage earner, and he waited till 70 to take his benefits. Because he waited till 70, let's say his check is $4,000 a month now. As you'll see in just a few minutes, if he passes away first, the widow does get those delayed retirement credits he got by waiting, but she get that full $4,000 at her own full retirement age. That $4,000 would not go up if she delayed her widow's benefits past her own full retirement age. She gets the ones he earns, but she didn't get any credit for waiting past full retirement age for her own widow's benefit. Now, when you're making that kind of decision about what benefits take when, you can't really make that in isolation of your other financial circumstances. Sometimes, in general, I say most people take the benefit too early. That doesn't mean everybody should wait. Some people should take it early. It depends on their personal finances. It can depend on what's happening in the economy. That's not something I can do. All I know is Social Security Medicare, but that's something that your advisors can do with the firm here. They can help you put that all together with your other financial circumstances, help you make that decision. So don't make it in isolation. You've been real quiet. Before I go on to wives and husbands and widows and widowers benefits, and then after that on to Medicare, any questions so far about retirement benefits before I move on to the spousal and widows benefits? Let me ask one for you. So people usually ask this, so I don't usually include it at the body of it, and that's how do they compute your benefits? And the answer is going to show you how much wrong information is out there about Social Security. Thanksgiving's coming up for too long. On Thanksgiving Day, anything your brother-in-law is going to tell you about Social Security Medicare after eating turkey and watching football will be wrong. Anything your coworkers, your neighbors tell you about Social Security will be wrong. I've been working in the area over 40 years, haven't found one exception to that. Now, every other part of the state, when I tell that joke, instead of saying watching football, I say watching the Cowboys. But here, I just say watching football. So. But everybody's going to tell you they use your last 3 or last 5, last 10 years of earnings to compute your benefit. That never has been remotely close to being true. Your retirement benefit is based on your highest 35 years of earnings. Highest 35. Before they pick out those high 35 years, though, they go back and adjust all your past year's earnings for inflation, turn your past year's earnings into current dollars, and then pick out the high 35. So the latest years don't mean more than the other. If your highest earnings from the past will always be highest because they're keeping pace with inflation. Let me show you how that works. Let's say somebody worked in 1976 and made $16,000. Now they're filing for their Social Security benefits. Now, $16,000 does not sound like a high salary, does it? In 1976, that was a great salary. You could buy 2 brand new Corvettes and half a Camaro for $16,000 in 1976. They turn that $16,1976 into current dollars. That's well over $100,000. They do that with every year of your earnings and then pick out the high 35. And they always use the high 35. So if somebody works after they're receiving benefits, if they earn more this year than the low of the 35 they already used, they drop the low year, plug the higher one in there, and raise their check. So always use the high 35 inflation-adjusted earnings, years of earnings. Any other questions before I go on to the spousal type benefits? Yes?
How does any of that change if you're self-employed?
Well, if you're self-employed, the question was, how does any of that change for self-employed? It really doesn't change. You pay Social Security tax. It's called self-employment tax, that Social Security tax on your net profit. Now, being a self-employed person right now, you can legally take a whole lot of deductions. And the people, when they're self-employed, they like to avoid as much tax as they can, so they take every deduction they can. And it depends on what kind of business you're in, but sometimes you can really lower that net profit down. The problem is you're lowering your Social Security check down too, because it's based on that. And one of the places I worked for Social Security was Bartlesville, Oklahoma, big ranching area. And I would see these ranchers come in driving brand new Mercedes every year. Look at their Social Security earnings record. They never had a net profit more than $2,000 in their history. They weren't breaking the law. They were taking all their legal deductions, but they had a very small Social Security check. So if you want to increase a check, IRS never goes after you if you pay too much tax, right? If you don't take all your deductions, IRS doesn't care. So sometimes you have to keep that in mind. Yes, absolutely. Any others? Yes?
Will you address the solvency of the whole program?
Yeah, solvency, your grandchildren's grandchildren draw Social Security. It is not going to go away for so many reasons. But this recession we had, which is now about 14 years ago, shows one huge reason why Social Security will never go away. Because Social Security is the largest source of income everywhere. Here in Texas, Social Security pays $7.5 billion a month in benefits. $7.5 billion a month Social Security pays in benefits just in Texas. And almost every penny of that gets spent. Because if you're 80 years old, you're no longer saving for retirement. So you're spending that check because it's coming next month and next month. How many jobs does $7.5 billion a month turn into? People think if Social Security went away, it just affect people on Social Security. No, it affected this restaurant. In 2008, 2009, when the recession hit, working people got scared and quit spending because they're afraid they'd get laid off next, which made the recession even worse. But that $7.5 billion a month was still getting spent, keeping this restaurant open, keeping all these stores and restaurants open until times got better. A lot of economists concluded the biggest difference between 1929 and 2009, a 10-year-long depression, just a very severe but short recession. We didn't fall into another Great Depression in 2009 because Social Security exists now and didn't back then. That $7.5 billion gets spent kept us out of another Great Depression, which makes sense. It makes a lot of sense because Social Security started paying monthly benefits in 1940. Before 1940, this country averaged a depression, not a recession, a depression every 17 years. Since 1940, we've had zero. We should be in about our 5th one right now. Why? Social Security started paying those benefits, that money started getting spent to keep the bad times a lot less bad than they would have been. Plus, human costs would be tremendous. If those checks didn't go out next month, just in the Houston area, you'd have an additional 250,000 potentially homeless people. Because in Houston, there's 250,000 people whose only income is Social Security. Now, I'm not going to mislead you. I've thought through this. Most of them wouldn't become homeless. You know why they wouldn't? They'd move in with you. And without Medicare, you'd pay all their hospital and doctor bills. When somebody tells me Social Security is going to go away now, this is what I tell them. Do not downsize when you retire then, because you're going to need a bedroom for mom and one for grandma if Social Security goes away. That's one, so it can't go away. Just think if there was an employer. If there's an employer in Texas whose payroll was $7.5 billion a month. That's just ridiculous on the face of it, right? But if there was an employer whose payroll was $7.5 billion a month, and that employer was thinking about moving to Oklahoma, think about how they'd fight so hard to keep that employer here in Texas. And think about if they did move, the devastation economically that would cause. That's why Congress isn't going to let that happen and expect to be reelected. So it's not an optional program. It can't go away. You know, the government borrows money every day and has for the last 75 years. It's borrowed money every day to keep the military active. Social Security's never borrowed one dime from anybody. Nobody says the Army's going to go away, and they're not, but neither is Social Security, because this is important to the future of this country. Medicare can't go away either. Once again, people think if Medicare went away, it just affect people on Medicare. No, it affect everybody. Back when I was working at Social Security, a hospital in Tarrant County, which is where Fort Worth is, asked me to come speak at a retirement center for their employees. It was budget time. It was this time of the year, budget time. Congress thinking about cutting reimbursements to hospitals by 2%. Congress thinking about cutting Medicare reimbursement to hospitals by only 2%. When I got to that hospital, they said, well, we're having an emergency board of directors meeting. Some people in that meeting want to a 10-year session, so can you speak at a later slot? I said, sure, I can wait. That meeting they were having was what they'd do if Congress passed that 2% cut in Medicare reimbursements. They got a meeting and said we would have to close down, we'd have to shut our doors. A little 2% cut in Medicare would cause the hospital to shut down. So if Medicare went away, it doesn't matter if you're 30 years old or what, you have an accident out on the freeway, you're just going to die because there's no medical facility to take you to, no hospitals, no doctors to take you to without Medicare. So no, these programs aren't going away. And if people say they are, either uninformed or they're lying to you to try to sell you something. Watch out for that. Yeah.
What about still working while you are after Social Security age?
Well, if it's what.
Does it hurt your benefits at all?
No, working can never hurt your benefits. The question was, what about if you're working after your Social Security age? Working can never hurt you. It can help you if it's one of your high 35. It can never hurt you. So somebody thinks, and that's kind of the idea of using the last 3 or last 5. People say, I get this a lot, and that's why I always mention that. People come up to me and they say, there's always a type of work I had a passion for. I love to do this type of work, but it didn't pay enough to raise my family on, so I couldn't do it. But now the kids are grown, I could afford to go do this, but since they're going to use my last 5 years of earnings, it's going to hurt my Social Security check. See, they're making a bad decision based on what the brother-in-law told them on Thanksgiving Day, right? It's not the last 5 mean nothing. It's your highest 35 inflation-adjusted years. Working can help you, but it can never hurt you. Any others? Yeah,
All right, Chris keeps trying to explain to me this. It hasn't sunk in yet. I have a survivor benefit, but I can't make a certain amount of money or I get penalized.
Yeah.
But he says, oh, well, you're going to get it back anyway, but they'll end up taking a month and won't pay me. So it's like, wow.
Right, you will get it back though. Okay. Okay, so let's just start with the basics here. If you're younger than full retirement age, younger than this age here, if you're drawing widow's benefits, spousal, your own retirement benefits, all those, if you're younger than full retirement age, there's a limit how much you can make from work without affecting those benefits. All that counts for that limit is what you're actually working for. They don't care about your interest, dividends, royalties, pensions, distributions from 401ks, IRAs. That doesn't count for the limit, only what you're actually working for right then. There's only 2 kinds of earned income that count for that limit. Wages, if you're working for an employer, or your net profit from your business if you're self-employed. The limit goes up with inflation, but it's not very high. This year it's $21,240. $21,240. If somebody, let's say somebody's 63 years old, drawing their Social Security, they go take a part-time job. If they don't earn more than $21,240 from that job this year, their benefits are not affected at all. If they earn above that, for every $2 they earn above that, $1 is withheld from their benefits. Let's say the 63-year-old made $23,240 from that job. Exactly $2,000 above the limit. They would hold $1,000 from his checks, 1 for every 2 he's above it, paying the rest of the benefits for the year. Once you reach full retirement age, though, no limit on your earnings from then on, no matter when you start. Once you reach full retirement age, no limit. Well, what they do is they have to withhold $1,000. They withhold full check amounts till they withhold enough. They pay full check amounts the rest of the year. So somebody, earnings were high enough, they had to withhold 6 checks for the year. So they had to withhold your first 6 checks of the year, and then pay the last 6 checks based on your earnings. Those checks you didn't get don't reduce your benefit from full retirement age on. When you reach full retirement age, for every check they withheld because your earnings were too high, from full retirement age on, your check is raised for the rest of your life for each check you didn't get. that's why you get it back. You get it back over the rest of your life with a higher check, basically. And there's a special rule for the first year that you retire. The first year that you retire, they can pay you a check for each month you're not working, no matter how much you made the rest of the year. So say somebody retired September 30th. They were at least 62. They're not working October, November, December. They can receive that check for October, November, December, no matter if they made $10 million January, September. The first year they retire, each month they're not working, they can receive a check. It's a special that somebody retire and go ahead and start their checks up right away. It only applies in that first year, though. If they went back to work the next year, if they made more than the limit, they'd withhold 1 for 2. It wouldn't matter when they worked or when they didn't. So it just applies in that first year retirement. Any follow-up questions on that or any other questions on anything? Okay, spouses benefits. Now, when we're talking about Social Security and say spouses benefits, that means both members of the couple are still living. To receive benefits on your living spouse's record, they have to be drawing their own benefits. You'd have to be at least age 62, and you'd have to not be entitled to more based on your own work. If your spouse is living, you have to take your own Social Security first. That offsets what you can draw on your spouse's record. So if you're entitled to more based on your own work than you can receive on your spouse's record, you just draw that higher amount you've earned based on your own work. And if your spouse is living, you always have to go ahead and take your own Social Security first. You can't just take a spousal benefit and let yours keep growing. If your spouse is living, you have to take your own Social Security first. When your spouse is living, anything you can receive on their work record is based on half of their unreduced full retirement age amount. So when your spouse is living, anything you draw on their record is based on half. If that spouse is deceased, then any benefits they pay the widow on that work record, they call widow's benefits. Once again, it could be widower's benefits, exactly the same for men or women. So every time I say widows, that includes widowers. Unlike a spousal benefit, which is based on half, a widow's benefit is based on the full amount of the deceased check if they're drawing their Social Security when they died. If they died before they ever drew their benefits, the widow's benefit is based on their full, unreduced amount. Let's take an example of the most common situation with widow's benefits. Let's say we have a husband and a wife both drawing Social Security. Say the husband's check is $2,500 a month, the wife's is $1,600 a month. If he dies before her, if she's at her full retirement age or older, her check will go up to exactly what his was. So in this example, her check will go up to $2,500 a month. If she was younger than full retirement age when he passed away, her check would go up to that higher amount, once again reduced a little bit for each month she's younger than that age. Widows and widowers can start drawing benefits as early as age 60 on their deceased spouse record. Now, widows and widowers have an option that does not apply if your spouse is living. If you remember, and I said it several times, if your spouse is living, you always have to take your own Social Security benefits first. That does not apply to widows and widowers. They can take whichever benefit they want first and let the other one keep on growing, switch to it later. For example, let's say I have a widow and she's worked herself, but her deceased husband made more money. So the widow's benefits are higher than her own retirement benefits. Let's say she retires when she's 62. At that point, she has the option of taking her own lower benefit, reduced for being younger than full retirement age, receive that till she reaches full retirement age, and then switch over to unreduced widow's benefit for the rest of her life. Or vice versa, her own was higher, she could take the widow's first, let her own keep growing. Her own would keep growing if she waited until 70 with those delayed retirement credits. So that does apply to anybody here. If you are a widow or widower, you're either unmarried or you did not marry your current spouse until at least age 60, because then you can still get the widow's benefits. I strongly encourage you to contact Social Security and let them give you all your options and dollar figures and dates. They do a lot of time for widows and widowers. They can tell you if you take the lower one now, you'll have this much less per month. But when you switch over to the other one, you have this much more a month for the rest of your life. To get that information from Social Security first, you might want to bring it back to your advisors here to help you make the right decision. But call Social Security first and get that information so you make an informed decision. Once again, let me pause before I go into Medicare. Any questions about wives, husbands, widows, widowers benefits before I move on to Medicare? Questions always slow down when the food comes. Well, let me mention divorced spouses. Once again, same for men or women. I'll just say a divorced wife, but a divorced husband, same for men or women. A divorced wife can receive benefits on her ex-husband's record if, first of all, they were married at least 10 years. She has to be unmarried when she applies for benefits. She has to meet the same requirements a current wife or widow has to meet, which means not be due more based on her own work for wives, be at least 62 for wives or 60 for widows. If an ex-wife does receive benefits on her ex-husband's record, her checks do not affect anything he or a current wife or widow might receive. Their checks do not affect anything she'd receive. She draws independently. And just like a current widow, if her ex-husband is deceased, she could draw benefits on his record as a divorced widow as long as the current marriage didn't start until she was at least 60 years old. So just like a regular widow, she could remarry after age 60 if her husband's deceased and to get those widow's benefits. Any other questions on the spousal type benefits? Okay, Medicare. Now, it does not take me a whole long time to explain what you need about Medicare, but it is by far the most important thing for you to remember, the most important thing I talk about for a couple of reasons. First of all, just as a program, in my opinion, Medicare is far more important than Social Security. Because Medicare gives us something we simply cannot get anywhere else. And that's health care insurance that pays first once you're 65 and over and retired from where we have our health insurance. When we turn 65, we are uninsurable. People forget, when these programs have been successful for a long time, like Medicare has since 1965, people forget what it was like before they existed. Before 1965, though, when you turned 65, unless you worked for an employer that gave retirees health insurance, because someone did back then, but unless that was the case, when you turned 65, you had no health insurance. And I'm not criticizing private insurance companies. They can't exist without making a profit. If private health insurance companies had to insure everybody 65 or over as primary payer, paying first, at a price we could afford to pay, they'd all be bankrupt because we're uninsurable at that age. When we're uninsurable by the tens of millions, only the government can insure us. So what Medicare means is we still have access to health care once we turn 65. That's worth more than money. You can't put a dollar figure on that. And second, you can't mess up too bad with Social Security. Maybe there's a strategy you could have used, and had you used it, at some point have a bigger check. But no matter what with Social Security, you still end up with that guaranteed lifetime benefit that keeps pace with inflation. You can't mess up too bad with Social Security. With Medicare, if you don't have your Medicare in place properly, we're talking about Part B, mostly the doctor's insurance. If you don't have your Medicare in place properly, when Medicare is your primary payer, and you get sick, you almost certainly will be bankrupt. And that is not an exaggeration. You'd be amazed how many people I talk to that Medicare paid $2 million in 1 year for one person. Usually more than half that's doctor bills. If they didn't have a Part B in place, that's their $1 million bill to pay in 1 year. Not hard to do, but you need to make sure you do it. First, let's talk with the basics. The two basic parts of Medicare are Medicare Part A, Medicare Part B. Part A is the hospital inpatient insurance. Part A covers the hospital bill itself when we're in the hospital. People say Part A is free. It's actually not free. It's a matter of when we pay for it. We pay for Part A while we're working, so we don't have to pay for that once we are retired. Excuse me just a second. Mm-hmm.
On Part A, does it pay your full hospital?
No, there's a deductible. That's why you're going to want secondary coverage.
Okay.
So we pay for Part A while we're working. If you're working right now, look at your pay stub. You'll see FICA tax divided into two parts. 6.2% Social Security tax, 1.45% Medicare tax. That Medicare tax is what pays for Part A. So we pay for Part A while we're working. We don't have to pay for that once we are retired. So if you've worked long enough to draw a Social Security check based on your own work, or you can draw on your spouse's record, even not drawing that check yet, Part A doesn't cost you anything once you retire because you paid for it while you're working. But Part A is just going to pay the hospital bill itself when we're in the hospital. So doctor bills and outpatient treatment, those are paid for by Part B. When I say Part B covers doctor bills, that's all doctor bills. If you've been in the hospital recently, you know when you get out, get the hospital bill in the mail. Then you get bills from all the doctors you saw in the hospital. Then here come bills from doctors you didn't even see. Since those are doctor bills, Part A does not cover those. Those are paid for by Part B. So Part B covers all doctor bills in or out of the hospital and outpatient treatment. Part B does have a premium, has a cost. This year that cost is $164 a month for most people, $164 a month. They just hold that out of your Social Security check each month.
Is that cost like regulated or?
Yeah, I'm going to tell you. Okay. So $164 a month is Part B for most people. Since Part B has that cost, it is a free country. You do have the legal right to turn down Part B. But don't write that down to hear the flip side of that coin. The flip side of that coin is it is a free country. You do have the legal right to bankrupt yourself. Because once you're 65 and over and retired from where you have your health insurance. Well, there is one case you don't want to take Part B. I'll talk about that. But once Medicare is your primary payer, once Medicare's paying first, which is once you're 65 and over and retired from where you have your health insurance or if you're self-employed, if you turn down Part B in that situation, you just made the biggest financial mistake you could have ever made in your lifetime. That's a mistake that is pretty much guaranteed to bankrupt you if you get a serious illness before you get your Part B back. A lot of reasons you want to make sure you have your Part B in place once Medicare's paying first, once Medicare's your primary payer. Number one, $164 a month's got to be a great deal, right? Anybody here want to start an insurance company and insure people from 65 to 100 whatever for doctor bills for $164 a month? Well, of course not. That's only 1/4 the cost of the premium. The federal government pays the other 3/4. So every month somebody pays $164 for the Part B, the government pays $492 for the Part B. We pay 1/4, the government pays 3/4. Now, if somebody has income above $97,000 for an individual or $194,000 for a couple, they don't get the full 75% subsidy from the government, so they pay more than 1/4 the cost. And how much more they pay depends on how much their income is above $97,000 for an individual or $194,000 for a couple. But here's the issue. Social Security has no idea how much income somebody has this year or even last year. So they have to base that higher premium on income 2 years before. So this year that premium is based on somebody's 2021 income. Next year on 2022 income and so on, always 2 years before. But if somebody's income has gone down in the last 2 years because they retired or became widowed, they can ask they base that premium on their current income, not what they had 2 years ago. So if you and your spouse have good jobs, you retire, you file for your Medicare Part B, and then you get a letter saying, based on your income 2 years ago, we have to charge this higher premium, then be sure and call them up and say your income went down because you retired, because they don't know unless you tell them. Just the fact that your income has gone down since 2 years ago doesn't mean you don't have to pay the higher premium. It has to have gone down for certain reasons they call life-changing events. The most common of those are retirement or becoming widowed. But they do list all those on the letter they send you saying you have to pay the higher premium. So if your income's gone down for any of those reasons, be sure to let them know. Any questions about that? Second, we're going to have to have Part B in place when Medicare is your primary payer. Once Medicare is paying first, nobody will pay anything Medicare to pay for except Medicare. Once Medicare is your primary payer, nobody else in the world will pay anything Medicare to pay for except Medicare. So once Medicare is paying first for you, if you don't take Part B, you just made yourself Medicare. Because you're going to pay those doctor bills out of your pocket to get your Part B back. That could be a lot of money in a very short period of time. People always tell me how much Medicare paid for them or their mother or father in 1 year. And the record for me was set one night in Plano. At this point in my talk, an attendee raised her hand and said that the year before Medicare had paid $2.1 million for a mother. In 1 year, Medicare paid $2.1 million in hospital and doctor bills. Over $1 million of that was doctor bills. Her mother had Part B, but if she didn't, that was her $1 million bill to pay. And she didn't have $1 million, so she would have been bankrupt. And her mother was still living, by the way. You think after Medicare paid $2.1 million in 1 year, it paid nothing the next year? probably paid that much every year until she passed away, right? And the third reason we'll make sure you have your Part B in place once Medicare's your primary payer is if somebody didn't take Part B at the time Medicare became their primary payer, and then they realize, uh-oh, I've made a huge mistake. So I'm going to run down to Social Security to get my Part B back. When they get down to that office, they got some good news for them down there. They got some bad news. The good news is, yes, they can get their Part B if they didn't take it at the right time. The bad news is they can't get it back today. If someone doesn't take Part B at the time Medicare's their primary payer, to get it back, they have to wait till the first 3 months of a later year to reapply for it. So every year, from January 1st to March 31st, is a chance for people who made a mistake and didn't take Part B when they should have to apply to get it back. If they apply for it in that first 3 months, it'll start the month after they apply, and that premium, that $164, will be 10% higher for the rest of their life for each year they should have had Part B and didn't. Now, the one exception, this is the one time you don't need Part B and probably shouldn't take it. The one exception. Why I kept saying retired from where you have your health insurance. When you turn 65, if you are still working as an active employee for an employer of 20 or more employees, and you're covered by that employer's health insurance as an active employee, then while you're still working for that employer past 65 and keeping their health insurance, Medicare pays second. The employer's group insurance has to pay first. Medicare does not force you to pay for Part B as secondary coverage. So when you turn 65, if you're still working for an employer of 20 or more employees, covered by that employer's health insurance as an active employee, you can wait until you retire to get your Part B. It'll start right away. There'll be no penalty. It's called a special enrollment period. Works for your spouse too. Say that you're working for an employer of 20 or more employees, got their health insurance as an active employee, you got your spouse on that insurance, and your spouse turned 65. That's the same as them working down there. Medicare secondary for your spouse until you retire. They can wait till that point, get their Part B right away with no penalty. Any questions about that? If you do that, if you're in that situation, you don't take your Part B at 65 because Medicare is secondary, then be sure and file for Part B at the very latest before the end of the month after you retire from that employer. For example, somebody was 68 years old, working for a big oil company, didn't take Part B because Medicare is secondary, and they retired today or anytime in October. Medicare would become their primary payer November 1st. They need to have the Part B in place November 1st. They'll have till the end of November, the month after retirement, to file for the Part B, have it start November 1st without a gap in coverage. I always mention that because if that person goes read the literature later, reads a pamphlet, it says that special enrollment period lasts for 8 months after they retire. But I don't believe that because I don't want anybody to have 1 second's gap in coverage. That person at the age of 68 retired in October, waited till December to file for the Part B. The second of that 8-month period, the Part B wouldn't start until January 1st. They'd have 2 whole months without any coverage for doctor bills. I'd be afraid to get out of bed if that was me. So if you do work past 65 like that, we're Medicare secondary, be sure and file for your Part B at the very latest before the end of the month after you retire, so there's no gap in coverage. Any questions about that? Yes?
Is it true if you're working and taking Social Security, that you can't contribute to your HSA?
Yeah, that's my next subject. But yeah, the law says if you're anybody who's 65 or over receiving Social Security automatically has Part A. They can't turn it down. And that's going to feed into your question here. So we're taking that situation, Medicare secondary, because you're covered by your spouse's active employment for employer 20 or more employees. Should you ever take Part A with Medicare secondary? Should you take Part B with Medicare secondary? Let's take Part A first. You might want to take Part A with Medicare secondary. It doesn't cost you anything. You'd have secondary coverage on a hospital inpatient bill. There's one situation, though, where you don't want to take Part A with Medicare secondary, and that's if you have something called an HSA and want to keep putting money in that HSA. An HSA stands for Health Savings Account. This is not your flexible spending that you lose at the end of the year. This is not that. This is your actual health insurance has a high deductible. You can put tax-free money in that HSA that you don't lose at the end of the year. Well, the law says you cannot put any money in an HSA once you are entitled to any part of Medicare. So if somebody took Part A when Medicare was secondary like that, they couldn't put any more money in their HSA. If they start drawing their Social Security at full retirement age, because there's no limit on their earnings, they can't put any more money in their HSA because it will automatically be entitled to Medicare Part A. Then one other thing about this. The Medicare law was written decades before the law established HSAs. Sometimes when that happens, Congress doesn't think about every little detail, and they didn't in this case. They missed something. The original Medicare law states that, and it still applies. If someone does not take Medicare Part A when they turn 65, then when they do file for either Medicare Part A or Social Security later, they will be entitled to Part A 6 months retroactive, 6 months before that month they made that application. That's the law. Social Security can't stop that from happening. So if somebody doesn't take Medicare Part A because they're still working past 65, they want to keep putting money in that HSA, they need to stop making those HSA contributions 6 months before the month they'll apply for those benefits, because they will be entitled to it 6 months retroactive.
Well, what happens if your employer didn't know that and they were still contributing to that HSA? What happens to that money? Do they still get to keep it, or?
Well, you'll get about 2 years later, you get a letter with the return address of IRS on there. Nobody else get that letter. Now, it's not a huge amount, because you can't put a whole bunch of money in there. It's not a huge amount, but you will owe taxes because you took that as a deduction, as a credit, basically. And you got to owe taxes on that money at that time, so with interest and penalties. Now, if it's all in one calendar year, it's not a big an issue. Let's say somebody did that, applied for Social Security right now, so they're going to be entitled back to April. But the year end hasn't come. They can usually, without any problem, take that money out that they contributed since April out of there. What gets a problem is if it goes back to the previous year and you already filed your income tax return, then it could be an issue. Then you probably have to just wait for that letter, or file an amended tax return, pay the money. So that's Part A. If you don't have an HSA and Medicare secondary, you might as well take Part A. It doesn't cost you anything. You'd have secondary coverage on that hospital inpatient bill to the employer's insurance. Part B. Should somebody take Part B of Medicare secondary? So the situation is Medicare secondary, because this person's covered by their or their spouse's active employment for an employer with 20 or more employees. Should they take Part B? The answer is probably not, and this is why. Very few people get to keep their health insurance from their employer anymore in retirement. Now, the exception is a lot of people down here, because oil companies make a lot of money and some of them still have it. But in general, most private employers do not let retirees keep health insurance. So we've got somebody working past 65, Medicare secondary. When they retire and lose that employer's health insurance, they very likely are going to want to buy something called a Medigap insurance policy, also called a Medicare supplement. It's a private insurance product you buy to help pay the about 20% Medicare doesn't of those hospital and doctor bills. You buy it from an insurance company. Insurance companies like to sell health insurance to who? Healthy people. They don't like to sell health insurance to people that are already sick, right? And I don't blame them. There's a protection built into the law for us as individuals, though. What the law says is the first 6 months you are entitled to Medicare Part B, you have what is called a guaranteed issue right. If you go to buy that Medigap policy, in the first 6 months you're entitled to Medicare Part B, they cannot turn you down or charge you a penny more for that Medigap policy, no matter how sick you might be. But once you've been entitled to Part B more than 6 months, the insurance company can say, no, we don't want to insure you, you're already sick, or charge you whatever they want to. So let's take somebody who might be tempted to go ahead and pay for Part B with Medicare secondary. So this person we're talking about is still an active employee. Their employer has 20 or more employees. They're covered by that employer's health insurance, so Medicare secondary. But even though they're still working, they have a serious illness. They're having to go to the doctor all the time. Several times a week they're having to go to the doctor. Every time they go, there's a copay, out-of-pocket cost. And it'd be a lot of dollars out of pocket every month they're spending. That person turns 65, they might say, I ought to take Medicare Part B. It'd pick up, a secondary payer pick up a lot of those out-of-pocket costs I'm paying now, and it might. But this is the danger. Let's say that person took Part B when Medicare was secondary at age 65. And then 3 years later, at 68, they retired. Lose employer's health insurance. They go to that Medigap policy. They're already sick, right? they very likely will be turned down or at least charged a lot more for that Medigap policy because they're already sick. But if they'd waited to take Part B at that special enrollment period when they retired, they would have had it less than 6 months. The insurance company could not turn them down or charge them a penny more, no matter how much it might cost them, because they're buying that Medigap policy. Within the first 6 months, they're entitled to Medicare Part B. So that guaranteed issue right is a very valuable thing. You don't want to waste it when you don't need it. That person didn't need it when they were 65. Might have been helpful, but they didn't need it yet. They needed it when they retired at age 68 and lose the employer's health insurance. Any questions about that? So that's why you usually don't want to take Part B Medicare secondary, because you might, even if you're healthy then, you might not be healthy when you retire 2 or 3 years later, right? You want to use that guaranteed issue right, so you can't be turned down with the Medigap policy. And back to the question you asked a while ago, you do want secondary coverage of Medicare, because Medicare pays about 80% of the hospital and doctor bills, like a lot of insurances do, more used to. Well, the issue as we get older is those total bills get a lot higher, and 20% can be a whole lot of dollars. Remember I said Medicare paid $2.1 million for that woman's mother in 1 year? That's a lot of money Medicare paid. She's glad that Medicare was out to do that. That's a lot of money. But if that was 80%, that means Medicare didn't pay over $400,000. That's still a lot of money to me. That means you have your financial advisor, that may be pocket change to you, but that's a lot of money to me. So you want to protect something. You want to protect yourself against that kind of catastrophic health event. There's 3 ways you can control those out-of-pocket costs. The first one's not your choice, but your employer's choice. Most people no longer have that option, but some employers still give retirees health insurance. They get to keep into retirement and past 65 as secondary to Medicare. If your employer still offers that, check that out first. That very likely is going to be your best deal. Because usually those employers are still putting some of their own money in there to bring your costs down. But even if they're not, they've negotiated a group rate for you. Now, some employers like to say they offer that, but they charge so much nobody can afford to take it. But if your employer's doing that, check that out first. Without the employer's health insurance, you have 2 other options to limit your exposure to out-of-pocket cost. Number 1, you can stay with what they call original Medicare. Original Medicare means there's no network. If you stay in original Medicare, you can go to any doctor that accepts Medicare anytime you choose. Medicare pays first. You buy that Medigap policy to help pay. That 20% Medicare doesn't pay from the insurance company. So that's original Medicare, no network. The other option is join a Medicare Advantage plan. It's like a Medicare HMO. If you join a Medicare Advantage plan, Medicare pays that plan a lot of money every month to give you your Medicare services. The way that limits your exposure out-of-pocket cost is in a Medicare Advantage plan, you pay the same copay for a hospital stay or a doctor visit. Whether that visit cost $100 or $10,000, you pay the same copay. And they do have an out-of-pocket maximum for the year too. They vary from plan to plan, but they do all have an out-of-pocket maximum. But you have to stay within the network. You have to go to their doctors, their hospitals. It's managed care.
So the secondary insurance then pays the 20% that the
Right, the Medicare doesn't pay.
Medicare doesn't pay.
Approximately 20%, yeah.
But if you have I've seen policies, I think it's Advantage policies or Medicare, I don't know, that say they pay 80%. So is it 80% of the 20%?
Well, no, not necessarily. It might be. Yes, it might be. That you're probably looking at employers' plans. Yeah, some of them, the employers' plans will do that. They'll pay 80% of the 20% Medicare didn't pay. Yeah,
Okay.
That's probably an employer plan. They can do anything they want to. Employers can.
So you have to ask them to make sure.
Yeah, right. Now, but with Medigap though, they're standardized plans.
Yeah.
So now at this point, it gets even more complicated. Because if you go with the original Medicare, you buy that Medigap policy. Well, there's Medigap, an insurance company don't make up their own Medigap policies. They're standardized plans set by the government. There's a Medigap policy plan A, Medigap policy plan B, C, D, bunch of them. If you go with Medicare Advantage, since you live in a huge metro area, every insurance company offers at least one Medicare Advantage plan in Houston. Some offer more than one. I saw a count of more than 40 Medicare Advantage plans being offered in Houston. The best one for you may not be the best one for your spouse unless your diagnosis and medications are exactly the same. Then Medicare Part D for prescriptions. D like dog, D like drugs. If you go with Medicare, go with original Medicare, you need to buy a standalone Part D plan for your prescriptions. If you go with Medicare Advantage, most of them include Part D. That's part of your choice, is find the one that covers your prescriptions the best, has the best Part D plan for your particular medications. Once again, 40 of them to choose from. Now, if you want to do this all yourself, I don't recommend it. If you want to do this all yourself, on Medicare's website, medicare.gov, medicare.gov, they have something called a plan finder. But I encourage you to use the experts. In this complicated modern world, everybody relies on experts. Everybody's an expert in one little sliver of the world, and that's all they know. There are no more jack of all trades, right? You can't know 2 jobs anymore. You have to know your one job. I know Social Security and Medicare, that's all I know. Don't ask me about anything else because I don't know. And so these are the experts to help you pick your best Medicare plan. What Medicare has done, since they don't have offices like Social Security does everywhere, what Medicare has done is they have trained people that work at nonprofit agencies. They train them on all the Medicare and health insurance rules that apply. They're very well trained. They used to help train when I worked at Social Security. They pay these nonprofit agencies to have these people out there to provide at no cost to us help with Medicare planning. They do a great job. They're on straight salary, not commission. So their only job is to get you in the best plan for them. They can help you decide whether to go with original Medicare or Medicare Advantage. Once you make that decision, help you pick your best plans. They usually work for your local area agency on aging, but don't even worry about that. Just write down 211. Everybody knows what 911 is. 211 has been around about 20 years now, but people aren't aware of it very much. It's not a Medicare number. It's for any social service. If you need a social service, just dial 211, tell them what you need. They'll get you in touch with that agency that provides that service. So when the time comes, just dial 211, say you help with Medicare planning. They'll get you in touch with Medicare trained professionals. As I said, they help you decide where to go with the original Medicare, Medicare Advantage. Once you do that, help you pick your best plans. You can use them time and time again. If you're in original Medicare, then starting October 15th through December 7th, you can change to another standalone Part D plan if your needs change for prescriptions. If you're Medicare Advantage, your needs change, you can change to another Medicare Advantage plan in that same time period. You can use the same people again and again. And that's all I have prepared for you. Other questions going back to Social Security? Yes?
There are tremendous benefits of Medicare Advantage, like hearing aids and vision. Can you comment on switching from Medicare Advantage to Medicare Supplement and the risks of underwriting and what you've seen?
Right, yeah. Well, this is what I tell people. If you're retired at 65, or if you're working past 65 for Medicare secondary, anyway, at the point Medicare becomes your primary payer, don't get the health insurance you want then, get the ones you're going to want when you're 90. Because while it's technically possible to change, theoretically possible to change, in reality it's sometimes very difficult to do. So for example, let's say somebody went with Medicare Advantage at age 65. They do get, in that situation, they do get a 12-month trial period. They can change within 12 months back. After that, they can change. During a later year, they can change. But they've been entitled to Medicare Part B more than 6 months, haven't they? If they got sick in the meantime, they may not be able to get that Medigap plan at a price they can afford. And so that's what I tell people is get what you're going to want for the rest of your life when Medicare becomes your primary payer, because it's very difficult to change later. And if you go with original Medicare, you have all those different Medigap plans. I'd encourage you, if you go with original Medicare, to get Medigap Plan G. Plan G, because, for example, somebody had Medigap Plan G this year. The most they'd be out-of-pocket hospital and doctor bills for the whole year would be $226. My mother's about to turn 92. She's doing very well. She just came off a 3-week cruise around the UK. But I find as people get older like that, they become anxious about things they used to not worry about. She has enough money to pay co-pays and deductibles, all that. But knowing she won't be out more than $226 for the whole year in hospital and doctor bills is one less thing for her to worry about, and that's worth a lot. But you can't buy a cheaper Part D plan when you're 65. I mean, cheaper Medigap plan when you're 65, and then expect to switch to Plan G when you're 80. Because think about it. Insurance companies make their profit on those Medigap plans off the younger of the senior citizens, right? They're not going to make much profit off somebody who's 85 years old, and they're probably going to lose money on them. So you can't switch to higher coverage plan later. So when Medicare becomes your primary payer, either at 65 if you're retired or later if you're working past then Medicare secondary, try the best to get in the plan you're going to want for the rest of your life, because it becomes very difficult to switch. Yeah. Yes.
Since you mentioned the other cruises, does any of the plans have out-of-country coverage?
Out of country, you said? Yeah, some of the Medigap plans offer for a temporary stay overseas. We're talking about temporary on vacation. They'll cover emergencies. Medigap Plan G does, for a matter of fact. So that's one of the ones that does. And so you don't have to buy traveler's insurance if you have that. Yes.
On the like Advantage plans, they promote that there's no premium.
Yeah, in this area, right.
How is that possible?
Well, they hope to sign enough healthy people up that they'll make a profit on what Medicare pays them every month. Yeah, I used to know some of the people up in the DFW area that would sell those policies, and they're friends of mine. They're good people, but I'd kid with them. But back then they had more in-person events, and I used to tell them, your ideal situation for an in-person event for people to sign up on your Medicare Advantage plan is a place out in the country a little ways for people to drive to. They have to be able to drive on the 4th floor of a building with no elevator. So to weed out all the people that couldn't make it up there, right? But that's what they're doing. They're hoping to sign up enough healthy people that they'll make a profit on what Medicare pays them. Now, they have a lot of competition here, and that's one reason why there's no premium. If you go west, out in West Texas, where there's not as many people, you may just have one or two in your area, and they will charge you a little premium because they don't have the competition. They'll charge you maybe $20 a month or something. But here, with that competition, they don't do that. Yes?
Medicare premium adjustment ever get recalculated? When does it get recalculated?
You mean how much Medicare Part B costs?
No, your data.
Oh, if your income's higher? Well, it's always income 2 years before. So let's say somebody...
It is a rolling.
Yeah, so let's say in 2021, somebody sold a bunch of property, had big capital gains, put them over the limit. Then for this 1 year, 2023, they'll have to pay that higher premium. The next year in 2024, they're going to look at 2022 income. If it went back to normal, then the premium goes back to normal. So it's always the income 2 years before. So that's what catches people. One thing is selling property, having a capital gains. They're surprised sometimes 2 years later the premium goes up. Or taking deferred money out, taking money out of your IRA or 401k. For example, let's say it's this time of year. You need to take some money out of your 401k. Well, it might be wise to take some out now and the other half out in January. Maybe it wouldn't put you over the limit each year. So of course, talk to your advisor about all that. But that's something always to think about when you're going to do something like that. It might affect your premium 2 years later if you take too much out. Any others? Well, thanks for having me. Thank you very much for your attention. I will hang around.